me now?
Yes, your presentation is visible now, madam. You can go ahead. Thank you.
Okay. Thank you. I will restart. Hi all. Today my topic of presentation is effective management of attention deficit hyperactivity disorder, a holistic approach. Okay. In the picture, you can see a classroom is showing already. In this, a particular behavior is different of one of the student. One of the student is standing above, and you can see it's entirely different from all other students, right? So this is the condition right now we are going to speak about. It's called ADHD, attention deficit hyperactivity disorder. Aim of study: to evaluate a safe, efficacious, and side effect-free treatment. To study the effectiveness of a holistic integrated therapy method in the treatment of ADHD. So findings of the neuroscience, brain imaging, and clinical research have made all understanding of ADHD as essentially a behavior disorder. Previously, we are considered this ADHD as only behavior disorder, but now it's changed. The new concept of ADHD as a developmental impairment of brain's self-management system in executing its functions. This new understanding provides a useful way to more readily recognize, understand, assess, and treat this complex syndrome. Blink conditions we all know. We need to recognize this particular condition, then understand it properly, then assess it and treat the condition, right? So this is a complex syndrome which impacts about 9% of children and almost 5% of adults. It's characterized by a persistent pattern of inattention and hyperactivity as well as forgetfulness, impulsivity, and destructibility. So there are certain myths about this condition. In our routine clinical practice, most of the clinicians used to get mental health practitioner, or even counselor or psychologist or psychiatrist. We used to get these kind of situations. Most of the times, the kid will be referred from the school, and parents will be bringing, stating my child is having some difficulty in concentrating in the class, he is irritable or impulsive, likewise class teacher is stating, likewise will be the presentations, okay? So there are so many myths about this condition. The first one is anyone who has ADHD will show clear signs of it during early childhood and will continue to have difficulties with executing functions for the rest of the life. Is it true or false? That is the first myth. See, during all these research work and the latest neuroscience related studies and all the clinical studies, we came to the conclusion that it's not a must that a person who is experiencing ADHD in a childhood will continue it in adulthood. Essentially, we can go through the DSM-5 category. In this criteria stipulates that at least some of the symptoms which is mentioned there should be noticeable by the age 12. There are cases only nearby 12. Previously, we have stated it as 7. Before 7, the child should be showing some of the symptoms related to ADHD diagnostic criteria. But recently, we changed it to 12. Around 12, there will be any of these symptoms will be presented by the child. Change from the 7 the previous years that already I mentioned. More recent researches have shown that many with ADHD function well during childhood and do not manifest any significant symptoms of ADHD until adolescence or later, when greater challenges to execute it or operate is they have to face something when a child who is having ADHD, certain symptoms are there, but it's not at all diagnosed properly, or it's came to anybody's consideration or that time, that later on when the child is going to senior high school level or the college level, where they have to face new challenges in their life, then they will be showing a particular situation arises, they have to face it, then they are not able to concentrate or do or complete the task completely, and that time only came to understand that the person is having ADHD symptoms. Then the next myth is people with high IQ are not likely to have executive function impairments of ADHD because they can overcome such difficulties. So this is also, it doesn't depends on the IQ value actually. Some children with ADHD gradually outgrow their ADHD related impairments, as I already stated, they get to the middle childhood or adolescence. For them, ADHD is a variety of developmental lags. It is not that much shown, like a little bit developmental delay, only like this will be shown. Most often, hyperactive or impulsive symptoms improves as the individual reaches adolescence, while the broad range of inattention symptoms, as I already previously stated, when the adolescent phase or the college years, then only it will be shown as an inattention symptom. The person is not able to concentrate on a particular task which need more attention, or he or she is not at all that much interested. The widest, that is the time when the individual faces the schooling time, high school time, or that college time, where the individual faces the widest range of challenging activity without opportunity to escape from the one which they have no interest to do, or they can't do according to their ability. Then only this ADHD will be diagnosed. So, rationale of the study. Currently available treatments in modern medical systems, that allopathic medical systems, have severe side effects such as loss of appetite, weight loss, fixed minds, social withdrawal symptoms, etc. So, it shows the need for more effective management of ADHD. So, in the current study, I used a holistic integrated approach, a combination of herbal medicines, certain Ayurvedic medicinal that's already available, and with Ayurvedic panchakarma, Ayurvedic purification therapies, and relaxation therapies like yoga and pranayama. Yoga and pranayama is related to again Ayurvedic Indian medicine, Indian mystic medicine. It's yoga is a lifestyle modification, and pranayama is also a lifestyle modification along with the relaxation therapy. Then there are other relaxation therapies like meditation, use specifically mindfulness meditation and JPMR, Jacobson Progressive Muscle Relaxation Technique. Then counseling therapies like CBT, behavior modification therapies, for the management of ADHD effectively. So this is a holistic integrated therapy. Then what are the basic symptoms we used to find in ADHD cases? Troubles paying attention. I already told about inattention. So that is the major diagnostic criteria. Inattention. People with ADHD are easily distracted. Then next one is hyperactivity. Trouble sitting still for even a short time period. That is from the schools. The school teachers will be noticing it more, and we will be getting more and more outputs from the school teachers actually regarding this. That in the small classes like first or second junior school level classes, the child is not sitting. All other children are, while they are afraid of teacher, or teachers are scolding or giving certain disciplinary factors are there, so they are able to do the other children, but the particular child is not able to sit properly or listen carefully what the teacher is telling, or whatever the teacher is trying to teach, even a song or a particular play or whatever maybe. But that hyperactivity will be there. They will be roaming around in the entire class, like the picture I have shown, standing in above the desk or doing something here and there every time, distracting other kids also. So that is the hyperactive symptom will be always there. Next one is the impulsivity. People with ADHD may talk too loud, laugh too loud, become angrier than the situation called for. Some of the parents, when they bring the kid with ADHD, they show the child, maybe the boy child. That's a typical myth is there. Even being a boy child, they can do like they can shout more, they can do whatever the like playing things they are doing. It will be shouting things will be more. They will be pushing the kids playing with them more like this. So initially they will be, parents will be treating it as a tantrum. And they are showing simpling childhood tantrums only, like this they will think. But later on they will feel that child is more impulsive. Like it's no above the normalcy level according to everybody. Whenever everybody is listening to something, and every other children is doing something particularly, but this child is creating so much noise, like even laughter also. Everybody is laughing in a normal tone, but he's again continuously laughing quite a lot of time other than the usual schedule. We thought every other kid will be laughing. So likewise, the response will be little overdue in a way. So that means the child is more impulsive. Then aggressive nature also. While they are having some issues with the other kids, they will be more abusive in a way, or sometimes more aggressive also. So, according to the modern medical science, the basic treatment we are providing is psychostimulants such as methylphenidate and amphetamine and its derivatives. That's usually we give for the first line of treatment. And the second line of treatment, we usually use the tricyclic antidepressants usually. So, the drugs improve some academic skills. We can see the child is improving in the studies as the concentration level is improving, but there are some side effects came to notice, like loss of appetite, weight loss, fixed mind, social withdrawal, and some of the cases reported with the obsessive compulsive disorder also after the use. So likewise also as we are using tricyclic antidepressants and all those, these drugs on prolonged use may develop abuse kind of addictions and all those things also. So these are the negativity of that psychotherapy. Sorry, pharmacotherapy. Then now we are going for the current study therapy we formulated for this particular condition. This is called holistic integrated therapy. It's a combination of Ayurvedic or herbal medicines along with Ayurvedic purification therapy. It's called Ayurvedic panchakarma. Then relaxation therapies like yoga and pranayama. It's yoga, relaxation plus lifestyle modification plus meditation and JPMR as a proper ultimate relaxation. Then psychological intervention, counseling therapy, CBT used and behavior modification technique used. So it's an integration or combination of these therapies. Let us go to the herbal medicine portion. Herbal medicine portion, I used certain, it's locally available in all our medical pharmacies. It's prepared Ayurvedic medicine actually, the first three. Chandanadi Kashayam, the Kalyana Kashayam, and Drakshadi Kashayam. Kashayam is decoctions. It's a certain combination of herbs made in the form of certain decoction. That is called Kashayam according to Ayurvedic medicine. And I used some other medicines. It is also readily available in prepared form in the Ayurvedic medicine shops. This is some powder form. It's called Ashwagandha Churna and Saraswata Churna. Then I used three independent drugs in a way. These are independent herbal medicine actually. It's XT Churna means Glycisa glabra Churna. I will tell you in detail what is it. Then Brahmi, Bacopa monori, then Sandala asiatica. These three herbs also. So, ST Madhu Glycerabra glabra, it's another regenerative drug which is prescribed basically for ADHD. It's an excellent antioxidant, immunomodulator, and antidepressant, a memory enhancer also. It's described as a promoting agent of life, voice, hair, complexion, and strength also. Then next is Ashwagandha. This is called Arbitania somnifera. It's a powerful antioxidant and immunomodulator. It improves strength, muscle mass, and also relieves stress and anxiety. So you can see the importance of these two medicines in the mental health. Then other than this, I use certain Ayurvedic purification therapies. This first one is called Talapodichil. Actually, this is a way of preparing medicine, powdered medicine in a form of poultices. Okay, and it is applied to the head portion of the kid. Okay. So and it is keep for 30 minutes and later it's removed. So likewise, we used to do continuously this procedure for 7 days a week. The next is Shirodhara. This is applying oil like a stream. It will be poured directly to the head portion. Then next is Shirovasti, in which we will be directly keeping oil in the head portion of the kid. Then next one is Shiropichu. It's applying oil via a cotton, like a cotton pad soaked with oil is applied on the head portion. That is called Shiropichu. Then next one is Nasyam. This is an important purification method according to Ayurveda, which is used for clearing all the sinuses and basic sensory organs in the head area, like nose, eyes, ear, and all the sinus areas. So it will be properly purified or cleansed. So next one is, let us go to the relaxation therapies. First one is yoga. Yoga is an original and ancient holistic art of living that includes physical, mental, moral, and spiritual spheres. The Sanskrit word yoga means to join or union, and the practice of yoga brings to this union to all levels of oneself. The 8 limbs of yoga, that is yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, and samadhi. The most common out of this right now for the study we used as asana. Asana means simple sitting positions. Thera sukham asana. So when you are sitting comfortably in a position, that is called asana or sitting position. So this is a basic yogic procedure anybody can do. So for the current study, very simple asanas only used. That is called Shavasana, Padmasana, Vajrasana, Paschimottanasana, Sarvangasana, and Bhujangasana. So you can see simply in one of the sitting position. This is Padmasana position and the lady is doing pranayama breathing technique. Okay. Next is pranayama. Pranayama is a Sanskrit word alternately translated as extension of prana, breath of life force or breath control. It's a kind of breath control technique actually. It's only simple breathing exercise, I would say, but it's a yogic related breathing science. So prana means life force or vital air actually. The ayama means this holding or controlling the prana actually. So this is a set of simple breathing techniques where breath is intentionally altered in order to produce specific results. So for the current study, I used a particular pranayama technique. It's called Anuloma Viloma Pranayama. You can see the picture, how the lady is doing. This is explanatory. I will tell you the procedure. First, inhale with the left nostril and exhale with the right one. Starting from the left nostril, you can inhale like a deep breath and hold it for according to whatever the time you can hold. This depends on the each individual. The holding capacity will be different. Then leave the same air through the next right nostril. So starting from left, keeping the air, holding the air for whatever the seconds you can hold. Then slowly release the air with double the timing, very slowly. So that is the breathing technique actually. Later, continue the same process, that is inhaling and exhaling with left and right nostrils alternatively. Further switch to fast breathing, increasing the speed of breathing. After sufficient practice, the speed of breathing can be increased immensely. For a starter or beginner, you can very slowly inhale and keep to the maximal level of lungs in your air. When you feel a little tightness in your chest, you're not supposed to suddenly release the air, but very slowly you can release the air, taking double the timing you use for inhaling. This pranayama exercise should be practiced daily, preferably in the morning before the sun comes up. It should be done before your meditation or asana yoga practice. In this busy world, I can just easily be practiced while you are seated in a nearby your desk, traveling or anytime, whatever may be your comfortable position. There is no asana also needed. You can simply sit in a comfortable position and you can do it. In the current study purpose, we made the experimental group practice regularly this Anuloma Viloma Pranayama for 20 minutes, 3 weeks continuously, 21 days. Next is Jacobson's progressive muscle relaxation. This is a very important relaxation technique we used. This technique was developed by, as you already know, 20th century by Edmund Jacobson, psychiatrist and psychologist. Currently, it should be said that this technique is one of the most used among therapists for create a state of mental and physical relaxation. This technique is based on the idea of our mental and emotional state levels of it affects or contributes to the levels of muscular response. The essence of technique consists of tensing certain part of the body. The patient or whatever the kids we are getting. So we made them practice this technique by tensing a particular part of the body and immediately relaxing. They are told to, like, if suppose they are told to take their hand tight, then slowly do the breathing, keeping the hand tight and slowly release the breathing. Exhale, keeping the muscles of the hand, release it slowly. So like this. So every part of the body can be tensed and relaxed simultaneously. Paying attention to the sensation of the tension followed by relaxation helps a person to experience a pleasant sense of well-being, which carry over to their emotional and mental state. It's very important to really feel these sensations. It's not about tensing and relaxing, but rather learning how to become deeply aware of sense of contraction or release that are produced during these moments. Next is mindfulness meditation. This is a very important meditation technique. Mindfulness meditation is a mental training practice that involves focusing on your mind, on your experience, like your own emotions, thoughts, and sensations in present moment. Mindfulness meditation can involve breathing practice, mental imagery, awareness of body and mind, and muscle and body tension. How you can administer this? Find a quiet and comfortable place. Sit in a chair or a floor of your head, neck, and back straight but not stiff. Try to put aside all thoughts of past and future. Stay in present only. Become aware of your breath, focusing on the sensation of the air moving in and out of your body. As you breathe, feel your belly rise and fall. Watch every thought come and go, whether it will be a worry, fear, anxiety, hope. When thoughts come up in your mind, don't ignore or suppress it. Simply let them. Remind. So this is not suppressing a thought. In mindfulness, if you are not supposed to suppress any thought coming to you, let it flow or go away. If you find yourself getting carried away in your thoughts, observe where your mind went off to without judging and simply return to your breathing. So likewise, it become a habitually. You will become aware of your breathing. Likewise, you come back to that only. All the thought will go away. As the time comes to close, sit for a minute or two, becoming aware of where you are. Get up gradually. So total duration of the procedure in a day, 10 minutes. So we made them practice it for 10 minutes from initial date first to 21st day and made them regularly practice this for 10 minutes. The next is psychological intervention. For psychological intervention, we followed actually behavior psychotherapy. Behavior psychotherapy often is effective when used in combination with, as you all know, effective medication. So we already provided a proper medical regimen. Along with this is highly effective, we found out. Behavior therapy or modification programs can help to diminish our uncertain expectations and increased organization. Then we followed the typical cognitive therapy, which for the adults with ADHD. Metacognitive therapy, basically we used. It involves the principles and techniques of cognitive and behavioral therapies to enhance the time management and all those things. Then psychosocial intervention, behavior parent training. We concentrated on that also, and also behavior classroom management also. So these two are also very important. Behavior parent training, because as you know, when parents are the main person who are supposed to handle these kids, and parent training is very important. How to manage these kids. Sometimes they will simply consider this as a childhood tantrum. The child is showing only tantrums, and they will be becoming more abusive, beating the kid or something like happening. It will create severe childhood trauma to the child. So for that, we given them the proper behavioral parental training, and behavioral classroom management is also done. So in the current research process, we have done the research process via the one experimental group pre-post comparison design we used actually. The purpose is sampling method we used. 20 children in the age group 7 to 17. This is the target group we have used for the study. We purposefully selected from the OP clinic of Pratyasha Ayurvedic Center, Trivandrum, Kerala, India. Assessment of ADHD symptoms done via the assessment of pre-post data obtained. We used ADHD rating scale actually. Holistic intervention including herbal, formulation, lifestyle modification like yoga, pranayama, relaxation therapy like JPMR and mindfulness medication, and psychological intervention of CBT and behavior modification provided to the experimental group only. Pre-data of control group of 10 participants also collected. Pre-data of the experimental group is collected on the first day, and post-data of the experimental group collected on the 21st day of the therapy group. Then we have seen statistically significant difference in our findings, and it's proven to be effective. This therapy is proven to be highly effective according to our study. But we advise the children to come for the follow-up session 1 more month. As you know, this is a developmental disorder. So we need to do the proper follow-up sessions also for the patient. But we can see the drastic change in all the developmental and behavioral issues in further related consultation, follow-up consultations. The result already I mentioned. Holistic integrated therapy proved more efficient in managing ADHD symptoms according to our studies. So the conclusion of the current study is that holistic integrated approach, including the combination of herbal medicines, Ayurvedic herbal medicines, along with Ayurvedic purification therapies and relaxation therapies like yoga, pranayama, meditation, JPMR, Jacobson progressive muscle relaxation, and counseling therapies, CBT, and behavior modification as a combination or integration, thought to be highly effective in alleviating the symptoms of ADHD without any noted side effects. That's all for now. Thank you.
Thank you so much for being a part of today's forum, Dr. Nirmala. Thank you for talking to us about your research. I have a question for you from one of our audience, Jane Tosi. So Ms. Jane asks, is it right to say that pranayama is unnecessary, is at necessity in the practice of Raja Yoga?
Sorry, I didn't get you. Pranayama is necessity or unnecessity?
Is unnecessary in the practice of Raja Yoga?
Actually, Hatha Yoga and Raja Yoga, this is a basic level pranayama techniques only we can do for the kids. They are unless the current students we have chosen, the kids we are choosing for the therapy, ADHD condition is 7 to 17. Okay. So for according to that classical yoga point of view, above 7 only we are starting the yogasanas, and even breathing techniques are also supposed to be start 7 onwards. So for they are the beginners level, the kids are. So I don't want to them to go for higher level of pranayama technique. So that is why I use this simple Anuloma Viloma practice. This is very simple. Anybody can do. So this is not like that. This is unnecessary. But for this integrated combination, we used and we found it more effective to control their the like emotions and impulsiveness. Actually, it's more effective. According to my study, I found it more effective for that impulsive nature and inattention problem of ADHD students. Okay, so it is more relaxing and calming and providing them that mental soothing effect so that they are able to control their emotions. So according to me, I will say this is necessary because this entire therapy works as a combination. But according to other Raja Yoga concepts, we can say it is not necessary, unnecessary also we can say. But that depends on the condition. The situation varies. That is what I want to state. I think my point is clear now.
Yes, yes. Thank you for clarifying, Dr. Nirmala. And we thank you for taking your time and making it to today's global forum. It was a great talk. Thank you.
Thank you.
And let's have a round of applause for Dr. Nirmala.